And good morning, everyone. My name is Taryn Emmerich Choi. I am the manager of the Primary Care Office. It is February 16th, 2024 at 10 a.m., and I will be facilitating this hearing today. I'm going to ask people to please remain muted if possible until the time comes for public comment, just to keep background noise to a minimum, because there are quite a few of us on the call today. So this hearing is to receive public comments and opinions regarding the Barton Health Stateline Hospital Certificate of Need application as required by Nevada Administrative Code 439A-415. During this public hearing, we'll be hearing from Barton Health as they present their project. Then they will open for public comment. There's no time limit for each person's remark, although we ask you to please stay on topic and avoid excessive repetition. This meeting is being recorded and will become part of the public record. By remaining in this meeting, you are acknowledging consent. Okay, our agenda today includes my introduction, Barton Health's presentation, then we'll move on to public comment, and then before we close for the day, Barton Health will have an opportunity to re-summarize their position following all public comment. The Certificate of Need process aims to reduce the dilution of healthcare in rural areas and to prevent the resulting price increases and decreases in healthcare quality. The Department of Health and Human Services is conducting this hearing to receive public comment regarding the new construction of Barton Health Stateline Hospital. Public comments will become part of the public record and to be considered by the director. As a reminder, this hearing process does not include a dialogue or question and answer session. I will now ask the team at Barton Health to begin their presentation. Thank you. Ready when you are.
Right. Thank you. And Taryn, good morning, everybody. I'm Clint Purvance. I'm the president and CEO of the Barton Healthcare System. It's a pleasure to be with everyone this morning and to bring new information to the state and to our community regarding our hospital replacement and relocation project. Next slide, please. So we face many challenges in healthcare these days, and we do face some unique challenges in the Lake Tahoe Basin for the care and the priority of serving our patients in our community. One of the big challenges we face is that our current infrastructure, our hospital, was built over 60 years ago, and that infrastructure is aging. And we actually have two hospitals on our current campus in California. One of them is an acute care hospital that houses many of our services related to ER and our trauma system, inpatient beds, surgical services, OB, labor and delivery services. And the second hospital is our long-term care hospital, where we have 48 beds to care for residents around the region and the community in both long-term care and skilled nursing with skilled nursing needs. Both of those structures currently have some challenges due to current seismic mandates. The seismic mandates in California require acute care and long-term care hospitals to become compliant with seismic laws and restrictions related to safe facilities. We believe that those are good mandates to have and regulations that we want to meet for the safety of our patients and for our team members. In looking at the aging infrastructure that Barton has with its acute care facility, part of our facility that's 60 years old is not able to be retrofit to meet the seismic requirements of 2030. That's placed the organization in a precarious position because the current laws in California would require the hospitals to close down that cannot be seismically retrofitted or upgraded. This has led Barton to take a look at all of our facilities, including our ambulatory practices on the outpatient basis as well, to determine where could we replace our current hospital. Our current California campus is built out, so we have limited growth opportunities where our existing hospital is on our California campus. And we have additional land on our Nevada campus that we could build infrastructure, either outpatient ambulatory offices or hospital. And so we've been looking at both of those as an option over the last several years. And really our priority in looking at all options for healthcare is putting our patients and our community first. We know that there's an increasing demand for healthcare in our region. We have an aging demographic population in Tahoe. The 55 and older age group is growing and expanding, and these are individuals who tend to use healthcare more frequently. We also care for the underserved populations, the Medicaid populations in both sides of the state line of our South Shore community, Medi-Cal in California, Nevada Medicaid in Nevada. Currently, we care for all patients, whether they're insured, underserved, or uninsured. Next slide. So in looking at our future for Barton Health, our hospital relocation project really focuses on that access to local high quality care and how can we expand that into the future, ensuring that we have a long-term viable community health system, one that's affordable for the community and one that's affordable for the patients. And as we recognize that we have 60-year-old facilities, building state-of-the-art facilities with leading medical equipment and technologies to make certain that the standards of care that we're delivering are the highest that are available for our patients here. Next slide. And so who is Barton Health? Well, in South Lake Tahoe and in the Tahoe Basin, we are the only comprehensive healthcare system in the basin. And that includes, as I mentioned, an acute care hospital with an ER and a level 3 trauma center that is certified and designated through the county and the American College of Surgeons nationally. We also are a world's best hospital. We pride ourselves on delivering safe, high quality care to our community. That is in fact our mission. And we've been recognized by many outside rating agencies as some of the top hospitals in the world, which is quite a recognition. 3 years in a row by Newsweek, which has been a great recognition for our teams and for our community. When you look at our long-term care hospital, U.S. News and World Report ranks us as one of the top hospitals. Many high-star, 5-star ratings throughout the health system and quality and safety awards for the care that we deliver. So we are committed to that high-quality care, and moving into the future, we believe new facilities will help us to achieve those goals even more so. Next slide, please. Our history is deeply rooted in the care for the community. In fact, back in the early 1960s is when an association of men and women got together to plan for and to raise funds to build a hospital. That hospital opened in 1963, and again, we've been present for 60 years, incorporated as a private, not-for-profit company. We were incorporated just as from a factual standpoint before the city of South Lake Tahoe was incorporated. And so healthcare with Barton Health's leadership has been present for the community for several generations and many years. Our goal is not only to meet the healthcare needs of the residents that we serve, but the surrounding region, including the many tourists that visit us on a daily basis. We've been known for decades for our orthopedic and sports medicine excellence. In fact, we partner with the United States Ski and Snowboard Organization to bring high-level care to Olympic athletes in the region. These tend to be winter athletes, as well as our local population and our local everyday athletes. Next slide, please. If you look at our healthcare system today, it's a bi-state health system. Our town is a bi-state town. The state line crosses through our town near our urban core. And so we have healthcare services set up on both sides of the state line. On the California campus currently, and for the last 60 years, we have our acute care hospital that is licensed at 63 beds, our long-term care hospital, which is licensed at 48 beds. Our emergency department sees approximately 20,000 visits a year. With our community health system, health center, which is our Barton Community Health Center, serving around 21,000 visits a year. And that said, that system is in fact our rural health clinic, which is there to serve the underserved. If you looked at our health system, however, the majority of the visits that we have in the health system are outpatient. And so our outpatient registrations are approximately 265,000 a year. And then many of our surgeries also being outpatient, about 3,800 a year. We have outpatient care on both campuses. We have a Nevada campus at Stateline, where we see many of our outpatient visits in primary and specialty care. as well as a surgery center on the Nevada side, where many of our surgeries occur as well. And that augments our current California campus, where we have our acute care hospitals and our long-term care hospital. Next slide, please. We're ready to rebuild the hospital and trying to meet the timelines and the constraints of California laws. We're on track to rebuild for the future. In fact, when looking at sites in and around Lake Tahoe, where our community and our primary service area resides, there are very few sites that can accommodate a healthcare system, a hospital being built. We have the good fortune that Barton did acquire the Lakeside Inn and Casino when it went out of business after the start of COVID in 2020. And initially, that parcel was purchased to consolidate many of our ambulatory outpatient services into one structure on our Nevada campus, on the Nevada side of the state line. However, as it became evident that our California campus would need to be torn down and replaced, and we had limited land in California to accommodate a hospital, a new hospital build, and with limited land in and around the South Shore region that could accommodate a hospital, that the site of the Lakeside became very attractive to build greenfield up from ground and then open as we close one hospital and move into the next. The hospital that we're looking to build for the acute care hospital is approximately 120,000 square feet. That's larger than our existing hospital. It has roughly the same bed count that we have today, 40 inpatient bed, with roughly 20 observation short surgical stay outpatient beds for patients that need to be in the hospital for less than 24 hours. We also are designing and rebuilding a 30,000 square foot skilled nursing long-term care hospital in the project, which would have approximately 45 beds. There is also space for a cancer center. Oncology is a need in our community, and we look to expand in the service of oncology and cancer care. And in the plan for the facility is additional space that we don't have today for the care of our patients with cancer. So the Nevada campus of the future will have our acute care hospital, which does have an emergency department, our current level 3 trauma system. Will be running out of that hospital and emergency department. We'll have surgical care. Our OB birthing center will be present in the acute care hospital. There'll be many primary and specialty care services, including ancillary services to support outpatient, such as medical imaging, pharmacy, and laboratory. And then again, our long-term care hospital as well. Next slide, please. If you looked at our rural community and population, we have a primary service area of about 26,000 local residents that stay year-round. However, any given weekend, especially in the winter and the summertime, that may grow up to 100,000 people that are staying within the basin. Many of those individuals in the South Shore staying in the urban core, which is in that state line core. Our secondary service area is about 134,000 patients. And of course, we're a bi-state organization, and El Dorado County and Douglas County are two of the primary counties that we serve. There are projected increases in growth in Douglas County, both in the Tahoe Basin and outside, while the future projections are that there will be declines in the El Dorado County region of Lake Tahoe and the areas that we serve as our primary service area. We see patients of all types and of all payer mixes, and we pride ourselves on caring for everybody, whether you're local or out of town or even out of the country. We're a not-for-profit organization caring for and serving the healthcare needs locally, regionally, and worldwide with some of the patients that travel to see us, as well as some of the patients that are here and need our care when they're visiting. About a third of our population that comes through the organization has private insurance. About a third, 35%, are elderly and have Medicare from a payer standpoint. And then we have a mix of the Medicaid and Medi-Cal services, about 25% cash pay or other government payers as well. So we see quite a blend of patients that we care for in our community, many of those being underserved. Next slide, please. We really want to make a difference for our patients, obviously, and we believe that expanding services and keeping our local patients local and serving our visitors as is at the core of our mission and what we strive to do in service to our community. We do have regional partnerships. In fact, Barton Health started the Carson Valley Medical Center, which is now Carson Valley Health, 30 years ago. Barton and Renown are now 50-50 partners in that joint venture in Douglas County down in Minden, Nevada and Gardnerville, Nevada. And Barton and Renown together are rebuilding that hospital currently. That hospital will open up in Gardnerville, the new hospital, later this fall. We also send our patients quite frequently when they need tertiary referral care to Carson Tahoe Hospital, which is the next closest regional care facility, and of course, Renown Health in transfers for trauma and other higher level of care that we do not provide here. From a California and Nevada bi-state location standpoint, both our California campus and our Nevada campus will send patients to all of these entities. In fact, the Nevada campus is close in proximity to, a little bit closer in proximity to where our patients are most frequently sent in Carson City and in Reno. We also believe that there will be lower cost opportunities in the state of Nevada to conduct business. In general, there are less regulations and it's a friendlier business environment in the state of Nevada, and that is true for healthcare as well. We do believe that will allow for us to reduce some of our costs as an organization, which will mean lower costs to not only our community, but to the patients we serve and to the insurance payers that we contract. We currently contract and work with all patients' insurances within our health system. We also believe that a new facility, again, will bring significant improvements not only to the facilities and the size of the facilities and spaces from an efficiency standpoint, but from a technology standpoint. And so when our 60-year-old hospital was built, we did not have things like surgical robots, the Da Vinci robot or the Mako robot, which we have today. This equipment is larger than what we would traditionally use in open surgery or laparoscopic surgery. And new technologies require new spaces, and we're excited to build new spaces to house new technologies that we have today and in the future when they come. Next slide, please. We also know that this project will mean a lot to the South Shore community. And whether you live in California or Nevada, a hospital centrally located to the urban core of our South Shore community, which is one community, will be readily accessed by both visitors and our local residents and the region. It is a gateway project to the South Shore. It is one of the first projects that you'll see as you enter into the urban core of the South Shore from Nevada. And that gateway project will have many health and wellness aspects. It'll also set the stage for what our community stands for, which is a vibrant outdoor wellness and health focused culture. Because we are taking and have demolished an old dilapidated hotel that was there, we are able to restore the site and have significant improvements in the environmental impacts, not only to the site, but to the lake and how we'll treat surface water and how we'll deal with water in general that moves through the land of that parcel. Because there are newer facilities, we'll see significant improvements in energy conservation and efficiencies. And because of the use being different, it's a hospital versus a hotel casino, we'll also see a reduction in the vehicle miles traveled and the amount of transportation in and around that project. A hospital requires less vehicle miles traveled than the casino and hotel that was there previously. We also look forward to partnering with agencies to make sure that we have a great transportation system so that there can be not only free transit, but public transit in and around the healthcare campus of Nevada and into our South Shore, California community as well. Next slide, please. When we think about the opportunities from an economic standpoint and from a job growth standpoint, of course, a project of this magnitude will be estimated to create at least 100 high-quality construction positions for the new hospital design and construction. That project is roughly a 3-year project. We do have permanent staff that as we expand services, that permanent staff will expand as well, with approximately 700 full-time equivalents, and that's greater than 1,000 employees with a range of skill sets and expertise to provide care, maintain new facilities and equipment, and to serve our community. We also know that to Nevada, there'll be a direct economic impact as some of the businesses around our hospital will see an increase in business just due to the workforce that will now be on that site. And again, being closer to that urban core, there are many businesses in that urban core that our team members as well as our patients can visit when they're receiving care or serving the community at this facility and site. Next slide, please. So we're ready to rebuild our hospital and take the journey into the future, the next step of transforming our healthcare system. Of course, we have to think about the financial impacts of building a new health system, a new hospital, and also updating and maintaining the current infrastructure that is seismically sound on our California campus. In order to do this, it will require us to look at three areas for funding the project. One are our cash reserves. We have significant cash reserves in place to pay for a portion of this project. We're also very minimally leveraged, meaning we have very low debts. In fact, at the time of the start of this project, essentially Barton will have no debt. So we'll have the capacity to take on loans, and we'll be looking for opportunities to take on some debt to fund the project. We also have an incredibly engaged philanthropic base in Tahoe. In fact, the first hospital was built on philanthropy, and the monies raised by the community, we anticipate there'll be significant philanthropic efforts here to also support the rebuild of our hospital. So we're in a fine, strong financial position moving forward to take on a project this size and continue expanding, growing, and serving with our existing operations. Next slide, please. If you looked at the timeline of what this project looks like, and back in 2021 is when we first purchased the Lakeside Inn and Casino. In fact, that, as I mentioned, was purchased so that we could expand our ambulatory footprint on our Nevada campus and consolidate some of our offices into one building. But as it became apparent with more of the seismic research that we did and projects looking at our own facilities in California, in 2022 and in early 2023, it was determined that we would not be able to seismically retrofit our existing acute care hospital and long-term care hospital, that they would need to be rebuilt. And again, that created many challenges for us because on the California campus, it would mean the demolition of existing hospital structures, the discontinuation of certain hospital-based services for a period of 3 to 5 years, as a new hospital was built on that site, which would not be in the interest of service to our community. We began exploring in 22 and 23 different sites that could accommodate a hospital. The Lakeside Inn and Casino site that was purchased several years previously became the site that looked like it could accommodate the project well and would be closest to the urban core, the majority of the population base in Tahoe. In 2024, we're going to spend most of the year receiving community input from our team members and planning the facility. We also anticipate working with our community partners, Douglas County, the TRPA, and the state of Nevada, as well as the state of California, and then many of our partners in and around the basin to determine impacts and how to mitigate those and how to grow the opportunity for care of our community together. The 2024 will be a very busy planning year. In late 2024 and 25, we anticipate certain levels of project approval. Again, we have many agencies to work with. This really is a first step with the state of Nevada in the CON process. As the project is approved, we hope to break ground or at least do some site work in 2025 in the summer related to the project, and then be in full construction in 2026. The project, because of its scope and size, is approximately a 3-year project, and given the winters that we experience in Tahoe, we anticipate that in 2029, our new hospital will be ready to occupy and open. At that point in time, we will decommission the old hospital, move into the new hospital, and then we'll be looking at what can we do with the existing infrastructure, some of which is still has useful life and still will be in place to serve the community's need on our California campus. And so we'll spend some time redesigning our California campus. Right now, we're looking at our California campus to continue with many of the ambulatory visits that we do today, including in primary care, in specialty care, our rural health clinic, some surgical opportunities for care of the community in an outpatient setting, and many more opportunities when it comes to ancillary services such as lab and radiology services, and then repurposing some of the existing buildings and structures for workforce housing. And we have a great need in our community for workforce housing, and we hope to be able to repurpose some of our older infrastructure that is aging out to accommodate workforce housing and the development of more residential units for our community. The campus in California is in a residential neighborhood. It's in the back of a residential neighborhood. And so we do look forward to turning over many of the properties there for the development of further residential opportunities for living. The campus in Nevada is, of course, in an urban core in closer proximity to, again, many of the not only residents and visitors that we see, but in fact, if you looked at the Nevada campus, it's approximately 5.5 miles away from our existing California campus. And we believe that that distance to travel for acute care services will not have significant impacts, not only on the care we deliver, but the patients that we serve. And again, with our two campus approach to healthcare, maintaining services on the California campus is a priority for our California community and those that live in closer proximity to that campus. Next slide, please. Barton Health just wants to say thank you all for joining us today and for your interest in this project. We look forward to receiving your public comments today and taking those into consideration into the project, as well as in second quarter launching our public campaign for input and awareness of the project. Again, it's a multi-year project and we'll have many opportunities to engage our community. And our goal is to engage our community in the improvement of health and wellness and to set up a long-term viable healthcare system to serve generations to come. So again, thank you for your participation today. And Taryn, I will turn it back to you.
Thank you so much, Clint. That was great. It is now time for the public comment section of our hearing today. Before commenting, please state your name, who you represent for the record. If there are any participants that would like to testify, you can use the raise hand function that you can find at the top of Teams. Or if you're on camera and you just want to wave at me, then I will also call on you. So, oh, we have Assemblyman Gray straight away, hand up. Please go ahead and unmute and testify, please.
Hi. Good morning, everybody. Dr. Purvance, great presentation. I'm going to make this real quick because I'm actually sitting in an Assembly Health and Human Services Committee meeting right now. But I just want to say that, this project is just a fantastic project. It comes at the right time. It's bringing new technology to the community and advanced healthcare services that we desperately need within my assembly district and our communities. So like I said, I'm going to cut it short, but I just wanted to thank you and can't wait till this place gets done and we can cut that ribbon and start getting people in there. And as a side note, when I first moved to Nevada, I did work as an ER nurse in the old Barton facility, so I'm really looking forward to the new one. So thank you guys so much.
Thank you for your comment. Do we have anybody else raising their hand that would like to comment today? Or if you're on the phone, just shout at me.
This is Gerald Ackerman with the University of Nevada, Reno School of Medicine and the State Office of Rural Health, and we are looking forward to working with the folks from Barton Memorial and working with them in some of the services and technical assistance that our office provides as they move forward with this exciting project. Did you hear me?
Yes, thank you, Gerald.
Okay, thank you.
Any other people? Please feel free. If you can't find your raise hand, just unmute and I will call on you. A lot of people in today. Oh, I see someone. Kirk Ledbetter, please.
Yes, Clint, that was a great presentation. Really think this is a needed facility in Lake Tahoe, and it's going to be neat to see modern facilities. My family was involved in the original donation of land that kind of got the property moving in the South Lake Tahoe area. So it is neat to see, you know, a lot of movement and a lot of facilities staying in the Tahoe Basin to serve our population and visitors that come up here to the lake. So thank you, and hope things go smoothly today.
Thank you. Do we have anyone else interested in commenting today? There we go. Wes Rice. Go ahead. Thank you.
Thank you. As a commissioner with Douglas County, I am so looking forward to this project. They have taken, unfortunately, one of my favorite places to play, and but now it'll be not a little older, a little wiser. This will give me a place much closer to my home, so I don't have to drive clear across town when I have one of. Never mind, we won't go there. But the Barton family has been an incredible source of pride for many of us here in Douglas County and in the South Shore. And I can see no downside to this, only the upside. And the people who live in the neighborhood, it'll be walkable for them. We now have micro transit in South Lake Tahoe, and folks can go from their door to the hospital door, and no more $1,400 ambulance rides from Barton to Renown. So I can only see up here. So thank you so much for the project. Thank you for what you're doing. And Mr. Previns, I never say it right, but that's all right. We'll work on that at breakfast. Thank you.
Thank you so much for your comment. We still have a few guests joining us today. Is there anybody else who would like to provide comment?
Good morning, this is Carol Chaplin. Can you hear me?
Yes, go ahead, Carol.
Good morning. Thanks for the opportunity to speak this morning on behalf of Barton Health System. For the record, Carol Chaplin, CEO of the Lake Tahoe Visitors Authority, but more importantly, a 42-year resident of South Shore. So would prefer that you don't do the math on that one necessarily. Even more importantly, my family and I have been, clients, I guess, of Barton. We are probably in the frequent flyer club. As a matter of fact, I have two sons that were both born at Barton, one in '95 and one in 1998, the first of the new year for Barton. We've used all of their services, and this new development for Barton gives us so much more access to higher level care. Not that we haven't had it, we've had it in so many ways. And my older son has had 12 surgeries at Barton. And just this year, we brought him back home just because the health care was so good. And we can't see anything but higher and better quality and even more services that our local community needs. From a visitors authority standpoint, just like I was talking about my son, we have people that actually take advantage of our incredible team at Barton as well. And this new facility would increase that quality of care and variety of services, not to mention the fact that our community is also getting much more diverse these days. And we need different kinds of medical services. So I am in favor, and I will stop there, and I hope you will consider this project.
Thank you so much, Carol. If anybody else would like to comment, feel free to just unmute, tell me your name. You don't seem to be jumping to talk over each other, so. Not hearing any. While we wait, I'll give people a little bit more time. We did receive 2 letters of support via email that I will briefly read now for you. The Nevada Hospital Association sent us a letter saying they support Barton Memorial Hospital's project to build a new hospital in Stateline. They continue to say that Barton Health enjoys a wonderful reputation, and they believe that Barton will be a great addition to the healthcare delivery system in Nevada. We received another message from Senator Robin Titus, stated that she's sorry she's unable to make the hearing today. However, she expresses her strong support of the relocation. Dr. Titus goes on to say that the access of care is a priority of hers, and the move would go a long way to improve access in Nevada. Dr. Titus continues to say that Barton's application, they list the services that they already offer, in addition to expanded services that they would be able to provide. Healthcare opportunities do not come often enough to Nevadans, and we cannot afford to lose this one. Okay, any other people would like to give public comment before we move on from the public comment section?
Hello?
Steve, would you like to go ahead and provide a comment?
Yes, thank you very much. My name is Steve Teixeira, and I'm the Director of Government Relations for the Lake Tahoe South Shore Chamber of Commerce, also known as Tahoe Chamber. We fully support the Barton application for certification of the new hospital being planned for Stateline. Barton has a long history of service in our community, and as Dr. Robin Titus, Senator Titus indicated, healthcare opportunities don't come along very often, and we should certainly not lose this opportunity. So we are pleased, as the largest business organization on the South Shore, to support Barton's application before you today for certification. Thank you very much.
Thank you for your comment. Okay, anybody else would like to comment today? I'll keep looking for raised hands down this long list of people. I'm not seeing anyone, so I think we will move on, just in case anybody's going to jump in. No, okay, we will move on to Barton Health. We're going to give you another opportunity to provide a little summarization of your project and perhaps a little response to what you've heard today. Thank you.
Yeah, great. Thank you again, Taryn. And we thank our community and community partners for the broad support for this project. It is a transformational project. Obviously, we've been serving our community for the last 60 years. We look forward to serving the community for generations to come. We believe this opportunity on the Nevada side of the state line will be impactful for not only our local community, but the tourists that we serve and the regional patients that we care for that seek our care currently. We also, again, are very focused on the needs of the community and making certain that the 2-campus approach to healthcare is maintained. So even though the hospital will be moving 5.5 miles away from its existing site, that the 2-campus Nevada and California locations will maintain services to care for those who are close to those campuses for the vast majority of the care that they require. Again, we look forward to engaging the community this year in more public comment opportunities. And we're grateful for the opportunity to be in front of the state of Nevada today. Thank you for all of those that support the project.
Thank you, Clint, and the team at Barton today for your presentation. The Department of Health and Human Services Director will now review the findings of fact packet that our office will be putting together. That will include a recording and meeting minutes of this hearing today. And an additional public comment that was submitted to us as well. It is now 10:39 a.m. and the hearing is now closed. Thank you all for your participation.